First and foremost, I would like to thank you for making the time to come here and be with us at the launch of India's India's fastest and most precise breast diagnostic test. The reason for doing this initiative or taking this initiative is actually threefold. First and most important, Apollo hospitals, Apollo cancer centers have always been at the forefront of innovation and exceptional patient care in the country. Right from starting, Proton Cancer Center in Chennai, to launching the first cancer centers in various cities, to being today the largest integrated cancer center chain in the country. Our philosophy has always been to push the envelope and improve patient care. The second important thing is that breast cancer is the cancer which has the highest incidence among women in the country today. Hence, it's imperative for us to keep thinking about improving patient outcomes and improving patient care to the extent possible. And third and most important thing is that today breast cancer diagnosis takes anywhere between 5 to 6 days. And during those 6 days, a lot can happen. Especially in critical cases, every day, every minute is important. And hence, cutting that waiting time from 5-6 days to 1 day, I think is a significant step going forward in reducing the anxiety of females undergoing this test. Start treatment very early, which results in significantly improved outcomes eventually, cuts down on the treatment time and the complications associated with it. So I think, in a nutshell, this test is going to revolutionize breast care treatment, breast cancer treatment in this country, and we are glad that we have a wonderful team, multi-modality team led by Dr. Jayanti Tumse, Dr. Govind Rajan, Dr. Swarna, and Dr. Aruna, who have collaborated together to come up with this innovative test, which will again put us at the forefront of this fight against breast cancer and saving more lives. Thank you so much once again.
India. Well, I've been practicing for more than 20 years, and through the experience, and we all know that breast cancer is one of the cancers where the outcomes can be excellent. And to have fantastic outcomes, there are two main prerequisites, and one of them is early diagnosis. Yes, early diagnosis is a game changer, and that is what will determine the outcome of the treatment. So all the time we have been thinking of how early diagnosis could help, because it has immense value. It can add so much value to the patient that it is indescribable. So one of the things is early diagnosis can give us very good outcomes, which helps in faster recovery of the patient. It allows us less aggressive treatment options, which significantly reduces the emotional and physical burden on the patient. Early diagnosis also gives us options of less invasive surgeries, wherein breast can be conserved. We need not have to do mastectomy, we can do breast conservation surgeries. And of course, the anxiety of the patient, which is associated with waiting for 5 to 6 days, which normally it takes to give a diagnosis, can significantly be reduced. And we have in our clinical practice heard the stories of immense anxiety that a patient goes through in this waiting period of 5 to 6 days. They Google and they look at it, and only the anxiety goes very, very high. So I think this 24-hour diagnosis will be very, very welcomed by our patients, and we in fact did a pilot study, and the feedback that we got, this was a very young girl who came to us with a large tumor in her breast, and she is a single girl who's living in Bangalore, Her parents live in Bihar. She came to us with lot of stress. Her parents back in Bihar were equally stressed. When we examined her, she had a 6 centimeter tumor in her breast. We promptly sent it to our radiology department. We did the ultrasound and then we did a biopsy of the patient, and biopsy was sent to our pathologist, and within 24 hours she got the diagnosis. And to give a diagnosis that it is not cancerous is also equally important to bring down the anxiety. And the feedback that we got from this patient was very, very good. She was very happy that the diagnosis could be done so fast. And I really feel that this will be extremely important for women who are coming to us with breast-related products. Thank you very much.
So as a clinical advisor and head of the Department of Radiology, I am extremely proud to be part of this absolute new innovation, which is the one-day cancer diagnosis program, which is incorporated for breast cancers initially. So this is a very innovative technique and extremely patient-friendly. I mean, I can myself see whenever I do a scan on a patient, you can visualize the apprehension and anxiety on the patient's scan, like what is the result going to be or something like that. So waiting them for a week or so for the final diagnosis to come definitely will make them opt for other routes of easier management. It can be misguided also. So in such case, a 24-hour program definitely will make the patient choose the right path of the treatment, because the diagnosis is quite fast and quality. So in this way, we make sure that we have expert panel of radiologists who perform and interpret the scans, and we make sure that the quality is not compromised in view of the time. So both time and quality are given equal importance, and ensure that patient receives the results on time as well as with accurate diagnosis. So this is really a very good innovation from the Apollo Cancer Centers for women who have detected breast lumps. So the patient comes for clinical examination, is directed to a radiology department for mammograms or ultrasound. So we take the decision of performing one or more investigations, make a diagnosis, and then if there is any suspicious lump, then we get a biopsy as well done then and there, either with ultrasound or mammography guided, and then the samples are sent to the pathology department for the final histopathological diagnosis. So we have a good team, very efficient team at place, so who can do all this and coordinate and give a really standard 24-hour turnover. Thank you all.
I am here to just give a brief talk on accuracy of diagnosis and its impact on quality of life of patients in breast cancer. So imagine Dr. Jayanti has told that one patient, Lakshmi, waited for 6 days or 8 days to get a diagnosis of breast cancer, whereas the other young girl, she spent 1 day to get the diagnosis of breast cancer. So what a relief. So that means to say, like, we have to have the breast cancer diagnosis as early as possible so that the patient can get the earliest intervention and the better outcome. But the patient can finish our clinical examination, the radiological examination in a day. As we all know that the tissue diagnosis, which is the gold standard for any cancer diagnosis, usually it takes, typically the turnaround time is around 48 to 72 hours in the conventional methods. So when the Apollo has innovated this 24-hour cancer diagnosis, so the pathologist role has really become an important thing to reduce this turnaround time. So instead of making the patient to wait for about 3 days, we have tried our best to give the diagnosis within a day without compromising on the quality and the accuracy of reports. So this we have done few of the modifications in the conventional methods, which is a lengthy process where we receive the core biopsies from the clinicians, which is a very tiny fragment of tissue from the tumor. Because of its minuscule nature, so the fixation time has drastically reduced from 6 to 72 hours to 4 hours, and then the processing time also has come down to 6 hours. So the total processing of the entire tiny fragment is around only 8 to 10 hours, so that once the slides are prepared, they will be immediately submitted to the pathologist for interpretation. So all this could happen within 12 hours instead of 72 hours. So because we are getting a very tiny core of tissue which is a representative of the breast lump. So now based on the slides which the pathologist received, we have to examine them under microscopy to give whether the tissue fragment is cancerous or non-cancerous. Means to say whether it is malignant or benign. So if it is malignant, the next objective of the pathologist is to say the subtyping of the breast cancer, because this subtyping has a greater impact on the prognosis and the treatment choice. And the third is, we also would able to determine the predictive and prognostic factors of breast cancer, which definitely has an outcome on the breast cancer survival. So all these things we have thought about, we have innovated the entire conventional method and we have reduced the turnaround time so that we can give an accurate diagnosis of cancer, whether the patient is really suffering from cancer or not suffering from cancer. So all this would happen within 24 hours, so that finally the patient will be relieved of her emotional things. So it plays a major, the pathologist plays a major role in relieving the emotional aspect. If it is cancer, she has to accept it and see how to move on, what best I can do, what best I can get rid of with this. And if it is benign, she is the most happy. So I would like to extend my sincere thanks to be the part of this innovative system to provide the patients best care by giving an accurate and timely diagnosis, which definitely has a greater impact on quality of patients. Thank you.
I'm Dr. Manish Mantu, Regional CEO, Apollo Hospitals, Karnataka. We've gathered here to launch India's fastest and most precise breast cancer test, which gives a result in 24 hours as compared to the current time, which is about 7 to 8 days. So we want to cut down significantly on the time it takes to diagnose breast cancer in women and men, improve the outcome significantly, help reduce the treatment time, and improve the quality of life of patients significantly. That's our endeavor at Apollo Hospitals and Apollo Cancer Centers.